Extraprin is a combination of aspirin, acetaminophen, and caffeine. It is used for the temporary relief of pain from conditions such as muscle aches, toothaches, menstrual cramps, or headaches, including migraine. Aspirin and acetaminophen relieve pain by keeping your body from making certain natural substances, while caffeine helps increase the effects of aspirin and acetaminophen. It is important to follow the recommended dosage and timing for Extraprin to ensure its effectiveness. It is best to take Extraprin with a full glass of water and with food to help prevent stomach upset. Always consult with your healthcare provider before starting any new medication. If you are using Extraprin to self-treat, make sure to read all the directions on the product package before taking it. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, take it as directed. Take Extraprin by mouth as directed by your doctor, or follow the product package directions. Drink a full glass of water with this medication unless your doctor directs you otherwise. If you are using the tablet form, do not lie down for at least 10 minutes after taking it. If upset stomach occurs, you may take it with food or milk. The dosage is based on your medical condition and response to treatment. Do not increase your dose or use this drug more often or for longer than directed. Do not use this product for pain lasting longer than 10 days or fever lasting more than 3 days. Use the smallest effective dose. For headache relief, take Extraprin at the first signs of pain. If you are experiencing headaches along with other symptoms such as trouble speaking, weakness on one side of the body, or sudden vision changes, seek medical help immediately. If you have daily headaches, experience a headache that is more severe or different from your usual headaches, or have headaches caused by head injury, consult a doctor or pharmacist before using Extraprin. Additionally, if your migraine headache is not relieved, consult your doctor or pharmacist. If you are using drugs for migraine attacks on 10 or more days each month, do not use them more often or for longer than directed. Tell your doctor if you need to use Extraprin more often, or if it is not working as well, or if your headaches get worse. Consult your doctor if your condition lasts or gets worse, or if you have new or unusual symptoms, redness or swelling of the painful area, pain or fever that does not go away or gets worse. Some common side effects of Extraprin may include nausea, vomiting, stomach upset, trouble falling asleep, or a shaky/nervous feeling. If these effects persist or worsen, it's important to notify your doctor or pharmacist. However, many people using this medication do not experience serious side effects. It's important to stop taking Extraprin and contact your doctor immediately if you experience any serious side effects, such as severe stomach/abdominal pain, severe dizziness, fainting, vomit that looks like coffee grounds, black/bloody stools, ringing in the ears, loss of hearing, irregular/fast heartbeat, signs of kidney problems, or easy bruising/bleeding. In the rare event of a serious allergic reaction, seek medical help right away if you notice symptoms such as fever, swollen lymph nodes, rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, it's important to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you may report side effects to Health Canada at 1-866-234-2345. Extraprin contains acetaminophen, which can cause serious liver disease if taken in excessive amounts. Adults should not exceed 4,000 mg of acetaminophen per day, and those with liver problems or children should take less. It's important to check the labels of other medications to ensure they do not contain acetaminophen and to consult with a doctor or pharmacist before combining it with other drugs. If an overdose occurs, seek medical help immediately, as symptoms may include nausea, vomiting, and loss of appetite. It's also important to avoid alcohol, as daily use can further damage the liver, especially when combined with acetaminophen. Before taking Extraprin, it's important to talk to your doctor or pharmacist if you have any allergies to aspirin, NSAIDs, acetaminophen, caffeine, or other salicylates. Also, discuss your medical history, including asthma, blood disorders, ulcers, gout, kidney or liver disease, heart disease, high blood pressure, and stomach problems. If you are planning to have surgery or medical procedures, make sure to inform your doctor or dentist about your use of Extraprin, as well as any other medications or herbal products you are taking. It's important to note that Extraprin may cause stomach bleeding, and the risk may be increased when combined with alcohol and tobacco. Therefore, it's recommended to avoid alcohol and stop smoking while using this medication. Older adults may be more sensitive to the side effects of Extraprin, and children and teenagers under 18 years old should not use aspirin-containing medications for flu symptoms or chickenpox without consulting a doctor. For women of childbearing age, it's essential to discuss the benefits and risks of using Extraprin with your doctor, especially if you are pregnant or planning to become pregnant. This medication may harm an unborn baby and should not be used after 20 weeks of pregnancy. If necessary, between 20 and 30 weeks of pregnancy, the lowest effective dose should be used for the shortest possible time, and it's important to consult a doctor before breastfeeding while using Extraprin. It's important to be aware of potential drug interactions with Extraprin, as they could impact how the medication works and increase the risk of serious side effects. Be sure to keep a list of all the products you use, including prescription and non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. Do not make any changes to your medication dosage without your doctor's approval. Some products that may interact with Extraprin include acetazolamide, cimetidine, corticosteroids, ketoconazole, methotrexate, anti-seizure drugs, and certain medications for gout. It's crucial to consult your doctor before using Extraprin if you have recently received certain live vaccines. Extraprin may also increase the risk of bleeding when taken with other drugs that can cause bleeding, such as antiplatelet drugs and blood thinners. It's important to carefully check all prescription and non-prescription medicine labels, as many contain pain relievers and fever reducers that, if taken with Extraprin, may increase the risk of side effects. Additionally, Extraprin may interfere with certain lab tests, potentially causing false test results. Be sure to inform all lab personnel and doctors that you are using this medication. If someone has taken too much Extraprin and is experiencing severe symptoms such as passing out or difficulty breathing, it's important to call 911 for emergency help. Otherwise, contact a poison control center right away. In the U.S., you can call your local poison control center at 1-800-222-1222. For residents of Canada, you can call a provincial poison control center for assistance. Symptoms of an Extraprin overdose may include nausea, vomiting, loss of appetite, sweating, burning pain in the throat and stomach, stomach/abdominal pain, extreme tiredness, yellowing eyes/skin, ringing in the ears, rapid/shallow breathing, irregular/fast heartbeat, changes in urine production, dark urine, confusion, agitation, seizures, and loss of consciousness. Always seek medical help if you suspect an overdose. When using Extraprin, it's important to not share this medication with others. If you are taking this medication regularly or at high doses, your doctor may want to do some medical tests to monitor your liver and kidney function. It's important to keep all medical and lab appointments and consult your doctor for more details. Because Extraprin contains caffeine, it's best to avoid taking it close to bedtime as it may interfere with your ability to fall asleep. It's also important to limit the use of other caffeine-containing medications, foods, or beverages while taking Extraprin to avoid feeling nervous or irritable, having trouble sleeping, or experiencing a fast heartbeat. If you are using Extraprin for headaches, it's recommended to avoid certain foods that may trigger your headaches. Making lifestyle changes such as participating in stress reduction programs, regular exercise, and dietary changes may help prevent headaches. It's a good idea to talk to your doctor or pharmacist about lifestyle changes that might benefit you. If you happen to miss a dose of Extraprin, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. Make sure to store Extraprin at room temperature, away from light and moisture, but not in the bathroom. Keep it out of reach of children and pets. Do not flush it down the toilet or pour it into a drain unless instructed. When it's expired or no longer needed, be sure to properly discard it. If you have any questions about how to dispose of Extraprin, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.